Hello, good morning all. Today I will speak about the antibiotics. Whenever we are discussing regarding the duration antibiotics, it can be IV or oral, depend upon the patient condition. Except three conditions. One is infective endocarditis, meningitis, babies less than 3 months. For above three conditions, you should give completely IV only. So coming to the regular seeing cases, among these two emergencies, one is when you are suspecting meningitis, like fever, seizures, altered sensorium, any child care, we have to start with ceftriaxone and vancomycin. This is for the Streptococcus pneumoniae. Acyclovir for HSV, doxycycline for scrub, and artesunate for the malaria. So you have to study all these things. Once ruled out, you can stop the corresponding drug. Second one, severe malaria. As we know that is malaria required antibiotics. So severe malaria almost associated with 60 to 70% secondary bacterial infection. So until proven there is a no active bacterial infection, you should start IV antibiotics along with IV antimalarial. Once culture negative, inflammatory markers are normal, you can stop the IV antibiotics. After that, what we are seeing the regularly seeing the OPD plus IP cases. Among those, most important thing is the pneumonia. So there is a no proper data regarding pneumonia, how many days you have to give. But better to give at least less than 7 to 10 days you should not give. It should be 7 to 10 days for non-complicated pneumonia. Whereas empyema, it is nothing but the pus formation. After VATS procedure, total duration of antibiotics is the 3 weeks. If you see necrotizing pneumonia, you have to give the 6 week of antibiotics along with we have to rule out immunodeficiency. And second common is a UTI. For urinary tract infection, if is a diagnosis the cystitis, we can give 3 to 5 days. Whereas uncomplicated pyelonephritis, you have to give the 7 to 10 days. The drug of choice for a complicated one is the ceftriaxone. For OPD basis is the cefixime. But if you suspect ESBL, it is the culture report. There is a resistance to the cephalosporin and azotemycin antibiotic where you have to start the meropenem. And routinely seeing our next cases will be the scrub typhus. You have to start the scrub typhus doxycycline 4 mg per kg per day. So maximum dose will be 100 mg BD. Even 60 kgs also you have to give the 16 to 4 240, not like that. Maximum will be the 100 mg BD, either 3 days of ephemeral period or 5 days, whichever is the longer. For example, child fever subside on the fourth day, we have to give 4 plus 3, 7 days. The child fever settled on second day, you can give the 5 days. Next, coming to the our enteric fever. So the drug of choice will be the ceftriaxone for IV, oral you can go for the cefixime. Either 7 days of febrile period or 14 days total, which is the longer we have to be given. There is no role of adding azithromycin to the cefixime. Next, coming to the routine or OPD cases like ENT infections like ASOM, pharyngotonsillitis, parasinusitis, or sinusitis. These conditions we have to give at least 10 days of antibiotics. Remember that all ENT infections, ASOM, pharyngotonsillitis, sinusitis, we have to give the 10 days of the antibiotic. It may be IV or oral, depend upon the patient condition. Another important point is regarding ASOM. So all books like foreign books are telling that you have to go the high doses. But as our Indian organisms are not resistant to the that much of amoxicillin, we can use routinely 50 to 60 mg per kg per day. That is more than enough. Along with these, one newer point is added from last 2 to 3 years is the adding of the zinc for pneumonia cases. So if less than 1 year at 10 mg zinc, more than 1 year at 20 mg zinc. Thank you.